Okay, welcome back. So it's me, Pauline, again. I'm here to introduce the second half of the interview with Nicole and Sarah. And in this half, we get to talk about more on mental health and several ways that Sarah and Nicole actually practice self care. And I even asked some questions about how us as community members can be more supportive and what changes they hope for the future. And so enjoy the second half, and thank you for sticking with us. So after all that being said, mental health. How was your mental health impacted in the past year or 2 years even?
Oh, it was massively terrible. Being shut down from my one outlet of going to the gym and having that outlet completely cut off, let alone the social aspect of it, is, it really I felt isolated because you really thought you made all these connections with these people, and the pandemic really kind of put into light that, well, maybe I didn't make those connections.
Oh.
Maybe we're not as close as I thought we were. Like,
you started questioning.
And it made I'm a huge overthinker and an internalizer, so I started questioning everything. And it was bad. And then when we tried to get help and because nurses are really good at diagnosing themselves with everything. And so we're like, okay, this is what I think my problem is, and you're trying to reach out for help and you're trying to get help. There's no help.
As in, you try to reach out for
counseling.
Okay.
I finally got into my counselor through a backdoor way of an 8-week program. My company paid for only 8 weeks of therapy to meet with my therapist, and they would only pay for the first 8 weeks.
Okay. Sounds like an EAP or something, where it's limited for, not so big things, but usually they're big things if you're needing that type of support. Yeah. How was your...
It was not good.
Not good.
It was the same thing. I lost the gym, which is a big thing in my life, and had to work out from home, which I was very thankful. Every day thankful I had my home gym.
Yeah.
So thankful. That was a lifesaver, but it's not the same. And then having to isolate completely and go through this pandemic as a frontline worker dealing with it without any support. And then it didn't make it worse. My family was horrible about it, and they were a huge stressor, and I basically just don't talk to them anymore, and have come to different realizations with that. But better part of a year in counseling finally, but it took me forever to be able to get in. I recognized that I was struggling and having trouble coping, and I couldn't get in anywhere.
Yeah. We were capped for such a long... That's why I was saying that, for the past 2 years, that's the hardest I've ever had to work. And there are multiple reasons for that. More people were seeking therapy, which is amazing. But the other thing, too, is, oddly enough, and I learned this as well, is that, no shows are good sometimes, because it's when we get to,
catch up.
Yeah, and that wasn't really happening. Everyone was home. We got time, and also...
but everybody needed it.
No, totally. Yeah. They needed it. But also having telehealth, you can be on your couch, you can be in your bed and talk. So that really took away a lot of barriers for some people. So they showed up to therapy all the time.
Interesting.
Yeah.
That is interesting.
Grateful for that. But again, burnout happened so much faster.
I bet.
So much faster. So yeah, I started therapy myself in the past year. I needed to. I had to.
We all need an outlet.
Yeah.
And that's the thing is we all need an outlet. And that was one thing I was I have really close friends that I can rely on and share, and you know, even if we don't agree on everything, like we're able to have a conversation and I'm able to share, but like there's just some things like your friends can't help you with.
No,
and
you're
it's
right.
those deep down things that you're shameful to share with your friends. And it's not because you think that they'll judge you, like it's something that you're still trying to process and coming to grips with that. And like, and it's also nice to have that one person that you might have only ever met through a Zoom meeting, so you're just like, here's my issues.
Yeah, it's nice to unload. And
I think it's more like they don't know you.
True.
And so they're able to, you know, like a friend or a significant other might, you know, have a bias. But they're also
done this before.
They're also able to like kind of analyze going back and how things that have happened in your life have kind of brought you to this current state, and you can kind of see, at least for me, it helps me to see like, what is this feedback loop that I keep going into, you know, and why does this keep activating me? And it helps me, and that's just how I am.
Yeah, and that's how you present to your patients too.
But like a friend isn't going to look at like this feedback loop that you're doing.
Yeah.
You know, like my husband's not going to do that.
Right.
I mean, it takes somebody in therapy that's actually kind of listening in a different way. Like they have different ears.
Yeah, because like we identified that I have a negative gremlin, and that I definitely don't have a positive gremlin. Like my gremlin likes to find all the negative things that are going on, and we're going to highlight that. And so working with how to compress that, and going through already having that and then being thrown into a pandemic, it just escalated everything.
Of course, because all your what if scenarios is present.
Yeah.
Right? And some way of it is out there.
I think for me there was one day, or not one day, many days, but in the height of the pandemic, I went to work and got home, and I started looking for jobs not in nursing.
You wanted to switch?
I've spent a fortune on my career to get where I'm at as far as schooling.
Right.
And to throw, like, I was looking to throw it away and do something completely different.
And this was in the past 2 years.
Oh, yeah.
You felt that.
Oh, yeah.
A lot of people.
Oh, yeah.
There's not a nursing shortage.
That's why we have a shortage now, is so many people left. They either were close enough to retirement or they just said, screw this. Not worth it.
There's nurses out there. They're just not. They're done with working.
Yep.
They don't want to do it anymore.
And when I got there, that's when I was like, okay.
What's going on?
What's going on? Need to go into therapy.
Has that changed a bit for you?
Oh, yeah.
Yeah.
My therapist actually told me about this book called Trauma Stewardship. And you should read that.
Yes.
Did I tell you about it already?
No. Oh. You should talk about it.
I need to talk about it too. Can we have a book club? I don't know this book.
I read, like, for me, that book changed my perspective. And it wasn't a quick fix, like, but I was listening to it, and you know, they were talking about your why. Why do you do something? And the thing that was so scary for me is I'm like, I have no idea. I don't have a why right now. And so I just started journaling, and then it literally took like months for me to get back to why I do stuff.
Yeah.
But when I first started, I was like, I don't know why I do this job. I need to find something else.
Yeah, I need that book. Because I'm at that stage as well.
What's the name of it again?
Trauma Stewardship. I think I have it on my audio.
Did it help you? I do have questions about
It's
this.
somebody at a University of Washington.
Did it help you identify, like, because I have trauma that's had happened to me in the past, but I don't identify it as trauma.
That's possible.
It really talks about self-care. So
okay, I need that.
The author is a former social worker in an ER trauma center, and talks about how, you know, and it applies to anybody. Like, I've had Patrick read it, who's not medical at all.
Yeah.
And anybody can get something out of the book with how it's written. I was so glad she told me about it. Like, it was...
Yeah. We love giving recommendations in therapy.
Yes. She's like, I'm reading this book right now. You might like it.
Yes.
So,
Trauma
Stewardship,
Okay.
Laura Van Dernot.
And Connie Burke. Okay. We'll put in the description.
Okay.
Thank you.
Thank you.
But yeah, it was really, that's what, basically that book, listening to it and eventually like processing through with my counselor, I decided, I'm much better and I'm happy with my job again. But I mean, I just felt that I had no why. I didn't want to go to work. I didn't like talking to patients anymore. I didn't like helping them.
Yeah. You
just
closed
completely
off.
completely closed off, dark cloud, whatever you want to call it.
Totally. Man, you dissociated. That would be the term we would use. You checked out. So much so that you wanted to bail out. Yeah.
I've been asked, because I started nursing school in January, I've been asked more times by other nurse practitioners, why are you doing this?
Yeah, getting to that.
But it's a great question.
Right.
Like, you need to know why you're doing it.
And the only question I can give them is, this is what I was meant to do.
It's your calling.
Like, nursing comes to me so easily that, like, people are like, oh, it's so much work. And I'm like, what are you talking about? This is awesome. Like, let's keep doing this.
You have fun.
When my mental health starts going to shit in my personal life, I throw myself into work.
Okay.
And because it gives me a rigid routine of, this is what we're going to do. This is because nursing is very routine oriented. You have step 1, step 2, and it's almost like my brain can turn off. And I just go into work mode. And I'm just now at the point of realizing that can be my healthy coping technique, because then once I hit that feeling my burnout, I back off, and then I go through ebbs and flows of it.
Yeah. And that's just it. Jobs that require that we are dealing with people, and not saying this in a negative way, but doing work that involves working with people is exhausting.
It is.
And it's exhausting when you have to deal with them when they're vulnerable, because they are either going to be completely open to what you're saying, or they're going to come out fighting.
I just feel like and maybe this is just an overjudgment or whatever you want, stereotypicalization. It just seems like the people that are coming into the hospital don't have kindness at heart. And that has gotten, in the amount of time I've been doing this, people are getting less human and just mean. And
some entitlement.
Maybe,
that's
entitlement.
What we classify it as.
I don't know what it is, but they're just, there's no, empathy. There's no thinking about somebody else's shoe.
Hurt people.
Yeah.
Well, and
we do whatever we need to do to take care of me.
Yeah. Wow.
And a lot of people don't understand how we prioritize things.
We don't know the system.
Yeah. So if you're not being seen right away, that's kind of a good thing. Because you're not as sick as someone else who we have to pull back now. And they just look at it as, well, that person came after me. Why am I? I'm like, that person's sick. That person's near death.
So they get seen first.
They're going to be seen over you coming in to get checked in for STDs. You have to prioritize that, but you also have to be ready for the backlash of that unhappy person. And sometimes, I've gotten to the point of, I'm really sorry, we're doing the best that we can.
You get to that point. Yeah. I think part of it, and you can add on or correct me if I'm wrong, but I think we've been conditioned to be gratified instantly. Right? So when we see that someone cut the line, it's very personal.
And I think they've also conditioned society to have the healthcare system, and I mean, even you would probably feel this, to be a service industry, and it's not a service industry. It's not. It's something, yes, we serve people, but it's not service industry to where we should be competing. I mean, we should always give a high standard. That's just how we should do it, but we shouldn't be having to, basically justify be a waitress, justify our care.
Because the only people, so a lot of I know our system works off of patient satisfaction scores.
Yeah.
And
Oh,
so
no.
that is how.
Yeah.
Oh, no.
But do you know how many times I've gone to the doctor and I have had a great experience, but I'm like, I'm not going to fill that. I don't have time to fill it again.
I'm guilty of that.
Yeah. But the
Some
people
people will.
who do take the time to fill those out are the people who have felt that they were negatively
Yes.
had a negative experience.
Oh,
so then
man.
all the hard work that we're doing, they think that they have a negative experience, but what they don't realize is that we had OT in there trying to get them up. We've had this, like, we've thrown all of these services at them to get them better, but they had a negative experience because the hospital food tasted gross.
Yeah.
It's entitlement. I'm going to put it out there.
It is. Or, we have no beds in the hospital and they're complaining that they don't like the room that they're in. And I've just gotten to where I tell people, I'm like, look, you're lucky you have a bed and then you're not in the waiting room. Because there are people in the waiting room right now that
Need
are
it.
as sick as you and are getting treated in the waiting room. That's how bad it is right now.
Like in the chairs you're sitting on, like the waiting room chairs are being treated right there and then.
Or the hallway.
Is it gone? Oh.
Yeah, like very sick people are getting just treated in the hallway because we don't have beds.
Okay.
Yep, that happened a couple days ago. There was some very, very sick people came in all at once and it was in the hallway.
So you're still experiencing overflow. Like,
We have the beds.
however.
We don't have staff.
Okay.
There's not a nursing staff shortage.
There are not enough people to take care of the patients to staff the beds.
And they're already trying to push the limits of the staff that they do have.
Okay. So, let me see. Let's say 2020, was there a nursing shortage, but just overflow of patients, or is it?
I think 2020 made many people more than anticipated leave the profession.
Okay.
Whatever level you're in, whether you're a nurse, physician, whatever, I think more people just were like, I'm close to retirement, let's leave.
Okay.
And then when the vaccine mandates, tons of people left.
Okay.
Nursing is this, if you look on TV shows and all of these things,
It's not glamorous.
it's not a glamorous job. Like, it is, and it is very much portrayed in Hollywood as a glamorous job, or being a doctor as a glamorous job. It's not a glamorous job. Like, I've been hit, I've been pinched, I've been slapped, I've been spit on, I have been all of those things. You don't see that in the nursing home or in the TV shows. We don't have the staff to help 3 nurses get 1 patient up, but yet in the TV shows you have 3 doctors helping a patient get up. Like,
And that never happens.
that never happens. And so you have this
writing these stories.
over glorification of
Doctors.
what it actually is like to work in the healthcare
Okay.
system.
Or just people waking up after CPR. That never happens.
Oh.
That never happens.
Especially in their 80s.
I see.
They either die or they're on life support. Like, never gonna wake right up. Unless
Okay.
it
really wasn't a code like that.
Right.
So they
And
minimize stuff.
a lot
Right.
of
And
nurses
that's not okay.
who started in the nursing field hasn't been a CNA or hasn't worked in the nursing home have never seen a dead body. That's a traumatizing experience.
Absolutely. Yeah.
And so now you're taking what trauma they already have and adding more to it and not having a way of processing
Right.
that.
I mean, all of that, it's no wonder, like, people come in with these unrealistic expectations of how they're going to be treated and the services they're going to get when on TV or on the big screen is being portrayed as something else. Yeah. And that's in part, therapy for some people, too, because therapy is shown in a different way than it is in real life.
It's a lot of work.
It's
a lot of
work.
And you have to put the work in. You, like, a lot of people think, but it's the same with healthcare and your own health. You have to put the work
Yes.
in to get to the common goal.
Give you the tools.
We can give you the tools to do it,
Yes.
but we cannot fix you. you have to want to fix yourself.
Oh yeah, and I make that known. I'm like, I can't fix. No one should be able to fix you because you're not broken. You're not like a car where you can fix it.
But in healthcare, it's, well, can't you give me a pill to fix that?
They do many people treat coming into the hospital like an auto shop. Like,
Okay.
I'm going to do this. I'm like, it doesn't work that way. Your body can't handle it.
Yeah.
Like, that's just not the way it is.
Oh man. How do you take care of yourselves? Like,
I have a lot of habits.
a lot of habits.
I mean, that's why I have a garden. I have a white cat. I hike all the time. And that's why I like hiking by myself. I mean, it's great to go with people, but it's also very therapeutic for me. I can just lose myself in the woods or on the beach hiking.
Yeah.
And photography, all kinds of, like, I have all kinds of stuff like that. Journaling is great. Walking.
I like that. What about you? What do you do?
I'm still finding, I'm kind of like where Sarah's at. Like, I don't, besides nursing and my family, I don't know what my why is in life, and I'm still figuring that out. I have some unhealthy coping mechanisms that affects my physical health, but like, I work out. That is like my one thing of, even if it's just for an hour, like I do. And it's amazing how just like a really hard workout can just reset your whole entire day. So that's one of my ways of doing it. I've medication home.
And therapy, we're all doing therapy. That's definitely one way.
Those are, I would have to say, in the last year, working out, medication, and therapy have been my top three of keeping me where I feel like I'm above water. I might not be above water, but I feel like I am.
You feel it, yeah. And feeling is everything.
Yeah.
Feeling is why we behave in whatever way we do. Good, bad, neutral, whatever you want to call it. Yeah. Well, we definitely have a lot of things in common. And, like, we met in a gym.
Yep.
And it's so interesting. I think probably 90% of people go to the gym as, like, a way to cope with stuff.
I don't think so, though.
Okay.
I think, like, a lot of people go to the gym with the idea that they're going to get fit and get this, like,
so
body.
90 is too high. 90% is too high.
I think 90% is too high because, more people, because people that I work with think I'm crazy because I go to work. I work out at 5:30, and then I go to work and I work a 12-hour shift.
I get that a lot.
And I get it a lot. And I'm like, yes, the health benefits, absolutely. I will not take that away from the gym, but more of it is my sanity. And going there, getting a workout in, it helps me, I don't know, calm down and not get so amped up about some of the messed up stuff that you see, and just kind of take it with a little bit more, I don't know if it just tires me out or what.
That too.
I think it also, because like I'm the same way. Like, it's nice to just like, you just really get yourself almost so tired you just can't pick yourself off the floor, but 10 minutes later you're like, all right, let's go take a shower and get on with the day. I use it. Like, I've actually gained weight since I started CrossFit. I have not ever lost weight doing CrossFit, and it's something that I struggle with. But I want that to be the goal of it. But one thing in the pandemic that taught me is I cannot be without a gym because I was still working out at home, but I was not getting the same stimulus that I needed to keep myself in a positive spot.
I think it's the positivity.
Yeah.
And I know for me, like, it still is that way, but I've also changed my perspective. But when I was at my, like, I'm going to leave the profession phase, coming into work, and everybody is negative. Everybody's going through the same thing. Everybody is probably depressed and freaked out with whatever the pandemic did to you. And so you're coming in to work to this negativity. The gym has always, any CrossFit gym I've ever been to, it's always been a known positive source.
For sure.
Yeah. For whatever reason. It just is that way.
Yeah. And I think that, like, that's why we're friends, and even being able to sit here and have a conversation is being consistent with the time we go to the gym and like just having that type of community.
Yeah.
So you're right. It can't be 90%.
It's got to be less.
It has,
I don't know what it is, but
maybe we should. That could be the question of the day.
I
How
think-
many of y'all
come for fitness, or you come for mental
health?
Yeah,
Which one?
I think that is.
That would be a good one.
It would be.
That's a great one. Okay.
We'll have to let
Why
them
do you
into
work
that
out?
one.
Why do
Yeah.
you work out?
And just those two options.
Yes.
Yeah, like, because I think their idea is to get, like, they want to start. That's what gets them through the door.
Yeah.
But I think what keeps them coming back is that community of
Right.
positivity of, like, because, like, you don't know, like, I've cheered somebody on lifting 55 pounds. I've cheered somebody on lifting 300 pounds. Like, it does not matter when you step into a CrossFit gym, what is on that bar is the fact that, like, you are trying to be a better you.
Oh man. Yeah.
And I think that's what keeps us all coming back of being around like-minded people and having that process of, okay, this is what we're gonna, like, this is
I think it's the positivity for me that's addictive. Like, it's just, you know, you go somewhere, everybody's happy, so that's it. Like,
because when you exercise,
very contagious.
you get
It
endorphins,
is.
and endorphins make you happy.
Yeah.
And I love cheering for people. Like,
Yeah.
even if I know you or don't know you, I just want to just, hey, you're
Yeah.
doing great. Why
Yeah,
not?
It's just that positivity.
Yeah.
You know, that's you know, no matter what's gonna happen that day, like, everybody's gonna not really be happy about a hard WOD, but
Well, and I think our gym is very special. I'm just gonna come
What makes our gym special?
But we all try to, at least in the class, especially during a hard workout, someone in transition or in rotating to the next, like, lift or whatever, you can always hear somebody saying, "Go Pauline" or "Go Sarah," like, and it's throughout the whole entire workout. Not only is it coming from the coaches, it's coming from the athletes too. And it's like, how do you not be positive and be like, okay, I guess I should be going because they're watching me.
Right? You can't slack on a burpee. You know, as much as I would complain about it, and I always will complain about it,
Oh, yeah.
I'll do it. And especially hearing, like, encouraging words from y'all, like, all right, you got it. Yeah, I do. I hate this.
I think
so
it's just the
what's up?
CrossFit community. Like, I just remember I was living in a hotel, working in Wisconsin, and I would do my own workout, like running or whatever, and I'm like, I gotta do something else. And so I just started looking up CrossFit gyms, and I'd already been doing CrossFit before, and so I wandered into this gym, and the owner was there, and he was just like super friendly, super nice, like really welcoming. And he's like, "So, do you ollie lift?" And I'm like, "Well, yes." And he's like, "Just come hang out with us. We're gonna lift right now." I hadn't, like, done ollie lifting in like 6 months or anything. He's like, "Well," and I was like, "Well, I don't have any lifters." "Oh, here, choose your size."
Just brought you in.
And then just like went
on
with them
in.
and like did like a ollie program.
If you go into
and-
CrossFit with the yes attitude, you'll make friends.
yeah,
Totally.
Just
Yeah, and I
never
think
say
that's
no.
it.
Just say yes.
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 Okay. Say no to set boundaries. If you know you can't push it and you don't need to push it for different reasons, you can say no too. But yes attitude.
But because everybody always asks me, because I am a larger person, like, how do you do CrossFit? Because their idea is the CrossFit Games. And I was like,
See,
that's-
TV.
that is a small portion. CrossFit is 100% modifiable. It is like the greatest best friend because it will meet you at where you're at.
Totally.
And then you get to watch yourself progress. Because we might not repeat workouts that often, but we sure do repeat movements. And when you did this movement last time, you only got 10. But then this time, you got 11.
Yes.
And you're just like, I did one more than I
Exactly.
used to. Like,
Exactly.
so there's always that measurable, and it meets you wherever you're at. And, like, everybody's always terrified of it. And I'm just like, do what you can. If it's one squat, great. You did a great job.
You did a great job.
Let's go. Next
Yeah.
thing.
You move on. I love that. So then, kind of bringing it in, you've talked about how y'all help us. And you've talked about some of the barriers, some of the challenges. But how can we help you as a community? Like, what do you need from us to make your jobs easier, if possible, a little bit easier, a little bit to create less burnout for you, to not hit burnout quicker than
I think the one thing I could say is to realize that we're humans and we're not robots, and that we have feelings. You have no idea what we went through the room before that we came to you, and that if we ask you a question, there's a reason why we're asking that question, and we're trying to, as much as we're not verbalizing it, we're going through the checklists in our mind of, okay, what's the scenario of what we're dealing with.
Okay, we can do that. I think
just treating with kindness. That's the hardest part. Is there's just no, we bend over backwards or think about, somebody else's surroundings, but the people that we're taking care of, they, just like she said, they don't have any idea of what we dealt with before them. And of course, they're the center of their own universe. Everybody is.
Yeah.
But to have some kindness and not, take out whatever's going on in your life on the people that are taking care of you just because you're sick. And, just have a mutual respect. And I think that's lacking right now.
Right.
Kindness is massively lacking.
Yeah, I would agree. Definitely. I mean, I don't think I get met with that in the work I do, because people are coming in. I think both of our jobs include people who are vulnerable, but they show it in different ways.
They're ready for change, and with us, they might not be ready for change yet, and ready to fix the problem. Yeah.
I never thought about it that way.
Because, we come in and they're like, my arm hurts. Okay, well, now we have to ask a gazillion questions of why your arm, and they get annoyed with you that you're asking all these questions, and I'm like, we're trying to do this whole algorithm branch in our head of where are we going with this, and that's before. That's what I do before the provider steps in the door. So I'm gathering information to go tell my provider, so they have a kind of they kind of know what they're walking into.
But because we don't know the steps and have an idea in mind that's not being met, that's the reaction you get, which is...
And I think there's just a lot of, like you said, the immediate kind of satisfaction. And hospital time is not normal. You might it might say your surgery's scheduled for 10. That might be 10 a.m., 10 p.m., might be tomorrow. Like, hospital time, it's unpredictable stuff happens.
People who are sicker than you are come in and need...
Yes, and you get bumped.
Even if you have appointments?
Yes.
Okay. I think that's important to know.
Yes, so...
Even in urgent care, we have a long wait, and people get bumped because they are sicker than who was in the waiting room.
Yep.
Just because it's urgent doesn't mean it's urgent.
And I always tell people, if I tell them
facts,
we want to leave early in the morning, and I'm like, okay, I come in at 7. I will try and see you first. And I was like, but that may be different because I don't know what I'm going to get overnight, and I have to see the sickest people first. And
you put it out there.
Yeah, and I just throw it out there so that they have that expectation.
I've also found with the pandemic, if you put that expectation out first,
I've always said that.
Yeah. But it gives them a little bit, it kind of almost checks them a little bit.
Yeah.
Of okay, I understand now of, this is the scenario and this is what's going on. I won't give someone it's going to be 30 minutes before a provider sees you because I don't know what's going to walk through that door.
Right.
So I'm going to say, you're in the queue to be seen. That's all I can give you. Well, how much longer? I don't know.
Yeah. Man. We're so impatient. So impatient.
The excuses are the best part when they try to make you feel guilty about it. That's always the best one.
Oh, yeah? The games. But, okay, so there's a shortage of nurses, and that's always been a thing, right? So what advice would you have for, let's say, someone who's thinking about working in your profession? What advice would you have for them?
Volunteer first, so you know what you're getting into.
Become a CNA. Work in the nursing homes. If you can handle working in the nursing home and find love for it, it don't matter what you do, because that's the worst it's going to be.
Okay, so it's kind of like work your way, start
I think
volunteer.
you need to have some exposure, because you can volunteer in a hospital, a nursing home.
Oh, I never knew you could do that.
In high school, they can do that.
Okay.
You can get your CNA license when you're 18.
To have some sort of exposure into what healthcare really is, and not just put a lot of time and energy and money into an education and then you hate it. Or you realize, you really can't
I'm not good at this.
I'm not good. I can't handle blood. I can't handle...
Oh, man.
I went to so many girls in nursing school who can't, I can't handle the sight of the blood. I'm like...
Well...
We're not touching people.
Okay.
I've had people cancel out of school because of they didn't want to have to touch people. And
so they had some idea of what the profession would be like.
Right.
Oh, man.
So in some ways, whether it's getting a job as like a CNA, which is minimal commitment, or just volunteering so you can actually see what it's like to work in a hospital, work
I like that.
Any nursing student that comes up to me, they're like, I think I'm going to go to nursing school. Do you have your CNA license? No. Go get it.
Yeah. Start there.
Because if you can find love with it, and that's what was told to me when I first started. I wanted to get in the medical field, and the provider told me, go get your CNA license. If you love being a CNA, then it doesn't matter how high you get up into the healthcare world, you'll still find love for it. And it's the best advice I was ever given, because I found what I was good at.
Yeah, I like that. Is there anything that I haven't asked that you want to share? I mean, you definitely gave me more than the questions I have listed here, which is 10, and we talked a lot more. So is there anything that you feel like we need to hear that you want to share?
I think we've covered it all, really, for me.
Yeah, be kind.
Yeah.
Be kind. Okay. Then thank you for joining me on this amazing conversation. And I'll see y'all. Are you coming tomorrow, 5:30?
No,
I'm going to try and wake myself up.
Okay.
Yeah.
I will be there at 5:30.
I'm going to try and go. Yeah.
Okay.
It depends on if I can sleep tonight.
Okay. You're going to check in with yourself and see if you can, and then you just know you're not doing it.
Mm-hmm. I'm sleeping.
That's good. Take care of yourself.
Yeah.
All right.
Sleep is important. It really is. It
yeah,
really is.
totally. All right. Well, we're done.
Yeah.